Good evening.
Evening to you.
My name is Mary. I'm a student at Grand Canyon University of Social Work, and I'm doing this interview as part of my practicum, learning how to be a case worker, and I would like you to participate in the interview and answer a few questions that I'll ask you regarding your anxiety and depression.
Okay.
Before I proceed, I wish to request your informed consent to continue with the interview.
Yeah, it's okay. You can interview me.
Thank you. I also wish to assure you of confidentiality. The information you give me will not be divulged in a manner that will cause anxiety or be released without your permission.
Yeah, the only request that I'll have is that I don't appear in your video.
That's okay that you don't appear on my video. To begin with, I would like you to give me a brief history of your anxiety and depression.
To start with, I cannot actually point a finger or identify when I was or what caused me to have depression or anxiety. And I just was not feeling well, and I just went to see a doctor frequently. For my anxiety, I kept on rushing to the ER because I was having heart palpitations and stuff like that. And after frequenting the ER quite a number of times, they realized that the symptoms that I was having were more or less like anxiety. And that's when they said I had anxiety. But like I said, I can't put a finger onto when. But when it comes to depression, there could be quite a number of factors that could have contributed. And currently, I just don't want to discuss the issues that could have led to it.
Are there times of the day or night when you feel more anxious or more depressed?
I mostly feel my depression or the anxiety is mainly during the day. And the thing is, my anxiety is triggered more by physical feelings on my body, like if I feel my heart racing, I go and think like I have a medical emergency, or maybe like I'm having a heart attack. Or if I have pain to my feet, I think that maybe I'm going to have a stroke. Not that I've had any, but I probably could associate this with my job, the job that I have done for quite a while. I've been an ICU nurse for quite a while. So the symptoms that I know about patients, the stories that they have told me about how they got to get sick, I think they got into me and I started putting those symptoms on myself. So that's just my trigger of the anxiety. About the depression, I don't know. I'm just depressed occasionally.
Are there things that you do to lessen your anxiety and depression?
Yeah, they are. The depression, I use my medications, and I would say to a large extent I feel my depression is well controlled because I don't have that depressive mood that I would be. I don't want to do anything. I just want to stay in bed, feeling hopeless. That is not as frequent as it used to be before I started my medication. But the anxiety is what really bothers me. But I've tried to use some of the techniques that I've been asked to do, like deep breathing, telling myself I'm not in danger, also convincing myself what I'm thinking. I ask myself, is it true what I'm telling myself? I try to kind of like change my thoughts.
That's great that you use breathing exercises to try and calm yourself down. It's also great that you use self-talk to tell yourself that nothing bad is going to happen, and it has not happened so far. So it is important that you are